Good afternoon all. Today we are going to see about the genital tract fistulas. Fistulas, you are familiar with this word in medical surgical or nursing. So, medical surgical nursing, we have seen that fistulas, that is the abnormal opening. Fistula is an abnormal communication between the other nearby organs or the parts. So, definition. A fistula is an abnormal communication between two or more epithelial surface. Here, genital tract fistula is an abnormal communication between epithelial surfaces of urinary, that is genital tract, intestine, genital tract, skin, genital tract. These are the main, that is abnormal communication that occurs in the genital tract fistula. So, in the genital tract fistulas classification, we can say first genitourinary fistulas, then intestinogenital fistulas, genital tract skin fistula, urointestinogenital compound, that is genital tract fistula unspecified, not suspected, non-specified. You can see the other types, that is the vesicovaginal fistula, vesicocervical, vesicovaginal, rectovaginal, vesicocervical, this that is then periovaginal, urethrovaginal, vesicouterine. These are the classification. Then each one of them we can see clearly. So here I am not giving more explanation. So here genitourinary fistula, you can see that is genitourinary fistula, first one. That is what all are the fistulas. You can see that is the fistula. Here you see fistula is this one, that is abnormal communication, that uterus is there, bladder, vagina, that is the vesicovaginal fistula, that is genitourinary fistula. Here that is the vesico. Then genitourinary fistula, it is an abnormal communication between urinary and genital tract with involuntary escape of urine into the genital tract. Here fistula is there, then other communication, that vagina, vesicovaginal fistula, there will be the abnormal communication between urinary and genital tract. Okay, that is 2 to 7 million women affected worldwide, 0.2 to 1% of gynecological admission. Types: in bladder, vesicovaginal, vesicouterine, vesicocervical, vesicouurethral, vaginal. Then ureter, uretrovaginal, uretrouterine, uretrocervical, urethra, urethrovaginal. Then here numbers are given. Vesicovaginal, where it is, vesicovaginal 1, you can see here, vesicouretrovaginal 2, you can see, urethrovaginal 3, then vesicocervical, then urethrovaginal, then vesicouterine. Then etiology, genitourinary fistula, acute and congenital is there. And acute is again divided into obstetrical, gynecological, accidental. Acute means it is because due to the obstetrical conditions, due to the delivery or any wrong applications of forceps. You can see, have seen about the injuries, last class we have studied. Then gynecological also due to any surgery, that is cystectomy, that is any of the surgeries, that is the genital aerial surgeries. Then accidental. Etiology, congenital malformation, aberrant ureter and persisting urogenital sinus, mostly associated with other urinary tract abnormalities. Then accidents, road traffic accidents, then crush injuries to the pelvis, bone fragments can cause perforation of the bladder or urethra. Road traffic accident, how it is occurred. Avulsion of urethra, fall on pointed object. Obstetrical causes in developing countries, commonest cause is about 80 to 90% of cases. Developed near 5 to 15. Ischemic necrotic obstetric fistula. Prolonged obstructed labor. CPD, cephalovelvic disproportion and malpresentation. Trigone of bladder is nipped between presenting part and pubic symphysis. Ischemic tissue necrosis, sloughing genitourinary fistula. Slough takes some days to separate. Thus, incontinence develops 7 to 10 days after delivery. Okay. Then obstructed labor, trigon of the bladder. You can see that bladder in trigon bladder is nipped between the pubic symphysis and presenting part. Pubic symphysis, that is the pubical area. That is the pubis. You can see the symphysis and presenting part. The presenting part is the head. Then compression of ischemia is occurs. Then necrosis, fistula formation 7 to 10th of the postnatal day. Then obstructed labor, injury, fetal death, fetal incontinence, fistula formation first day, then urinary incontinence. Then complex urological injury, vaginal scarring and stenosis, secondary infertility, chronic skin irritation, offensive odors, stigmatization of them, and isolation, loss of social support, divorce or separation, worsening poverty, worsening malnutrition. Then obstetrical causes, traumatic fistula, instrumental vaginal delivery such as destructive operations of forceps, especially with the gland, injury inflicted by bony spicle of the fetal skull in craniotomy operation. In cesarean section, at a risk in patient with the previous LSCS, if bladder is caught in the suture can cause ischemic bleeding to the fistula formation, ligation of main branch of uterine vessels in case of hemorrhage due to the lateral extension of transverse incision in LSCS, ureters are risk of injury. Rupture of the scar of previous LSCS can implicate adherent bladder case. Such direct traumatic injury, fistula and incontinence follows soon after delivery. Then gynecological cases, operative injury in developed countries 70%. Gynecological operations, one or other part of the urinary tract is it's a danger. At the risk of total hysterectomy, especially radial hysterectomy, removal of both ligament tumors. Hysterectomy means the removal of the uterus. Hysterotomy means the opening. Here, the hysterectomy. Risk of urethral injury was 7 times greater with the laparoscopic procedures than with the open procedures. Urethra is threatened during anterior colporrhaphy and sling operation. Then post-surgical fistula, pathophysiology, unrecognized bladder injury during difficult hysterectomy or cesarean or surgery involving the anterior vaginal wall. Just over vigorous blunt dissection of bladder from the uterus and vaginal cuff suture incorporated into the bladder. In over vigorous angle, it will cause result tear in the post bladder wall or devascularization. Vaginal cuff suture, then tissue ischemia, necrosis leads to fistula. Post hysterectomy fistula is in the form like this. Malignancy, advanced carcinoma of cervix, vagina, advanced carcinoma of cervix, vagina or bladder may produce fistula by direct spread, radiotherapy, excessive, misapplied and even well applied irradiation of pelvic malignancy, carcinoma, enteritis obliterans, ischemia, necrosis of the fistula. Radiotherapy, how it is as late complication, takes 1 to 2 years. Of fistula, infective, vaginal, foreign bodies, forgotten and dead pessaries. Chronic granulomatous lesions such as genital tuberculosis, LGV, schistosomiasis, actinomyosis, rare cause of fistula. Okay, thank you.